So who's at risk for this disease? Why are we targeting baby boomers, and who else should we target? Nationally, HCV infection is the most common blood-borne infection, way more common than HIV. An estimated 3 to 5 million people have HCV, and in the 1980s, around 230,000 people were getting infected every year. But that dropped dramatically until 2001. It's only 25,000, and it stayed about the same. Now, cirrhosis doesn't happen in everybody who's got chronic HCV. It's about 20 to 30% of these folks get it after 20 to 30 years. Now, as I mentioned, it's almost 4 times as common as HIV and hepatitis B. And the other thing to notice is that in HIV, most of the people who have it, know that they are infected. That's not the case with either hepatitis B or hepatitis C. Most of the people who are infected don't know they have it. So how's it spread? How do you get it? Injection drug use is the most common cause. Then sexual transmission, although it's usually sexual transmission with really rough sex, it is not as easily spread as, say, HIV. Transfusions back before we were testing for HCV. And then there's some other people who just have no idea. In fact, a lot of people, when you tell them they have HCV, they have no idea how they got it. One of the things to really understand is that HCV has a segment of the population that is infected, and this shows you from 1988 to 1994 that the people who were mostly infected were born between 1940 and 1965, and that stayed pretty much the same fast forward from 1999 to 2002. So there is this bump in our population that has HCV infection. Now, this slide shows you who's most likely to get liver disease and HCC, cancer. So back in 1990, you can see that on average, the people who were infected with HCV were aged about 35. And then you go forward to 2000, and on average they were aged 45. Both of these groups, if you go out to the little blue section, are very unlikely to get liver failure or cancer. But now that they've aged, and in 2010, on average they're aged 65, you can see that that bigger section of the people who are infected are out there in that blue zone to my right, and that is the group that's at risk for liver disease and cancer. So it's growing. As these folks age who have hepatitis C, the proportion of people at risk for liver failure and cancer is growing. Well, in recognition of this, the United States Preventive Services Task Force said in 2012 that we should be screening every single baby boomer, in other words, people who were born between 1945 and 65, for hepatitis C. And they graded it quite high. So it's up there with the same standards of breast cancer screening and colon cancer screening. We do that by testing for antibodies to hepatitis C, and then if you've got those, we'll be looking for the virus using a PCR test. So here's a slide from the CDC that says that 3 out of every 4 people with hepatitis C in the country are baby boomers. And that's the crowd we really need to zero in on. But there are other risk groups, and I want you to know about them, even though screening hasn't been very successful when we try to target those groups. So in general, the CDC says, make sure you test these folks, but be sure you test baby boomers. So anybody with unexplained liver disease or an abnormal liver function test, injection drug use even once, or intranasal drug use, they should be tested. Ever in jail, they should be tested. On hemodialysis, if you've had a transfusion or an organ transplant before July 1992. So before that, we didn't really know what this virus was. We called it non-A, non-B, because it wasn't either one of those. And we finally found the virus and started to test for it in the blood supply in 1992. So after that, infections really plummeted through transfusions. If you got a tattoo in a place that might have a dirty needle, if you were born to somebody who had HCV infection, and if you were a healthcare or public safety worker, I'm a physician, so I was certainly exposed way back when, so I should be tested. And HIV infection is also an increased risk. And finally, if you were born in a high-risk country, some Asian countries and Africa. So this is the poster you might see around that tries to tell people millions of Americans have hepatitis C and most don't know it. And here they're pushing people to get tested if they were born between 1945 and 1965. But it's important to know that it's not an equal opportunity virus. In other words, in some groups, the prevalence of the disease is much higher. So, for example, as shown on the left-hand side of this slide, non-Hispanic blacks have a prevalence of about 6% with the antibody, compared to around 3% of Mexican Americans and non-Hispanic whites. In the middle, if you didn't finish high school, the prevalence of the disease is also about twice as high. And as you increase in your poverty level, in other words, people who are below poverty in their income have a prevalence of around 8% have the antibody to hepatitis C. Now, it also increases, obviously, with other behaviors like heavier drinking, having more lifetime sexual partners, but the huge one is injection drug use. If you've ever used drugs by injection, your chances of having hepatitis C are about 50%. So that's a very high risk group. So unfortunately, because hepatitis C affects people who are low income, it also means that it affects people who have no insurance. Even after the wonderful advances of Obamacare, we still have a lot of people, especially here in Texas, who don't have insurance. And these data show that most of the people who have hepatitis C on the right-hand side are uninsured. So that makes it a much more complicated disease to try to manage. So how about Texas? What areas of Texas have more HCV? And what about liver cancer in Texas? Well, this map is dated, but probably pretty accurate. So in 2000, there were nearly 400,000 Texans who were thought to have chronic HCV infection. And it was mostly along the Rio Grande Valley, although there are spots in the rest of the state that are also black. That's the highest prevalence group. But the really frightening news for Texans is hepatocellular carcinoma. So these graphs show you in red over time that the proportion of whites who have HCC incidence rates, this is per 100,000, goes up pretty steadily from 1977 to 2002. Same is true for blacks and Asians. It's much higher, but hasn't increased as much as the other two groups. What's really amazing is in the blue bar on the side, you can see that South Texas Latinos have a far higher incidence of liver cancer, hepatocellular carcinoma, than any of these other groups. It's a big problem here, and these are data from 1995 to 2006.